Chair, Senators, thank you so much for the opportunity to appear today. I'm here, as I said, on behalf of the Health Services Union and our 120,000 members working across health, disability, aged care, community services. Included amongst those are thousands of disability support workers who deliver care and support to the NDIS participants every day in homes, communities, supported accommodation settings and disability services across both metropolitan, regional and rural Australia. As you're aware, I'm joined by frontline disability workers who can speak to the inquiry today directly about the practical realities of these reforms and the impact that they may have on participants, their families, workers and service deliveries. So the HSU supports efforts to improve the integrity, accountability and long-term sustainability of the NDIS. Our members want to see fraud, exploitation and poor quality providers removed from the scheme just as much as the participants and government does. And the overwhelming majority of workers in the disability sector are committed to delivering safe, dignified and person-centred support, and they understand that public confidence in the NDIS depends on strong safeguards and effective regulation. We therefore welcome measures that strengthen oversight, improve the transparency, increase penalties for wrongdoing. We also acknowledge reforms aimed at improving scheme integrity and accountability. However, we do not support reforms that seek to achieve sustainability by transferring risk elsewhere in the system. Cost pressures do not disappear when supports are reduced and people are excluded from the scheme. Very often they are shifted to participants and families, to disability workers, to EDs, to aged care facilities and other public services that are already under significant strain. Our members work across all these sectors and they see the consequence of service gaps every single day. Nor can we support reforms that continue to treat the disability workforce as peripheral to the future success of the NDIS. If there is one message I'd like the committee to take from our evidence today, it is this. You cannot secure the future of NDIS without securing the workforce that delivers it. This is not a new proposition. Over the last several years, successive reviews, royal commissions, parliamentary inquiries have reached remarkably similar conclusions. The Disability Royal Commission, the independent review of the NDIS and the NDIS Provider and Worker Registration Task Force, as well as the recent Joint Standing Committee inquiry into NDIS integrity, have all identified stronger workforce regulation, professional standards and worker accountability as critical reforms. The evidence base is extensive and the direction of travel is clear, yet despite these broad consciousness, the workforce remains largely absent from the core architecture of this bill. So the most significant omission that we see remains the absence of a national worker registration scheme. Every other major sector in Australia recognises the importance of registration, qualifications and professional accountability. So nurses are registered, allied health professionals are registered, teachers are, aged care is moving towards that position more strongly, yet disability support workers who often deliver really intimate personal care and support of some of the most vulnerable Australians remain outside that equivalent national framework. So we say that this is not just an industrial issue, it is about it is a safety measure because it ensures that minimum standard of practice. It is an integrity measure because it strengthens oversight and accountability, and it is a workforce measure because the professional recognition, clearer career pathways and consistent standards help attract and retain skilled workers in a sector that continues to experience significant workforce shortages and turnover. Without a professional and supported workforce, many of the objectives contained in this bill will be harder to achieve. The second issue is what happens to people who are excluded from this scheme. So the HSU remains deeply concerned that these reforms are proceeding while foundation supports are still being designed, negotiated and implemented. So we know that state and territory disability ministers have themselves warned that they have not agreed to provide like-for-like services for people who leave the NDIS, and at present significant questions remain about what services will in fact exist and who will deliver them, how will they be staffed, and when will they be fully operational. So if a participant loses access to the NDIS, our questions are, where exactly do they go? What services will assess them? What support will be available to them? Who will deliver that support, and how quickly will that become available? So unfortunately, this concern's not hypothetical. Participants do not cease to require support because an NDI plan is reduced or withdrawn. The costs and pressures simply appear elsewhere. As I said before, they end up in EDs, in hospital beds, because there's no safe pathway for them to go home. Or they rely on family or carers that may not have the adequate knowledge or skill base to be able to assist someone with a disability. So we say that that's not sustainability, it's just cost shifting. So until those foundation supports are funded, staffed and operating in practice, there should be no pathway that leaves people caught between systems and forced into crisis-driven interactions with hospitals, aged care facilities or emergency services. Thirdly, we are particularly concerned about the risk of unintended consequences with the supported independent living arrangements. Evidence presented to this inquiry demonstrates that for many participants requiring intensive support, critical daytime support is frequently funded through the social and community participation budgets rather than through SIL funding alone. In practice, those supports are integral to maintaining a safe 24-hour support arrangement.
Yep.
For those participants, community participation supports are not an optional extra. They are part of the funding architecture that allows continuous care to be delivered safely. If those budgets are reduced without appropriate safeguards, participants do not suddenly require less support. Instead, providers face unfunded care gaps, services become harder to sustain, workers can be placed in impossible situations where participants' needs exceed the resources available to meet them safely. So the consequences aren't just financial. They disrupt routines, reduce staffing, unmet support needs, increase risks to participants and can contribute to higher levels of occupational violence and aggressions that are experienced by frontline workers. That's why we called for explicit protections to ensure that future commissioning or redesigning of SIL remains safe, sustainable and adequately funded 24-hour support arrangements. We are also concerned by provisions that permit automated decision-making. So the HSU recognises the need for efficiency in the scheme, of course, and given a scheme of this scale as well. However, technology can only assist decision makers and improve that administrative process. It shouldn't be allowed to stand alone and be a replacement for humans making that decision. Algorithms should never be the sole determinant of whether a person with a disability receives support, loses support, or has support reduced. It's too risky. These are complex human decisions with profound consequences, and they involve individual circumstances, functional impacts, health conditions, and support needs that can't always be reduced to a set of automated rules. So any adverse decision affecting participant support should be subject to meaningful human oversight, human clinical judgment. The lessons of previous automated government decision failures should not be ignored in this space. Finally, sorry, I'm almost finished. I just want to address whistleblower protections. So frontline workers are often the first people to identify fraud, abuse, neglect, financial misconduct or unsafe practices. So in many respects, they are the eyes and the ears of this scheme. The integrity of the NDIS depends on workers like those appearing before you today feeling safe and able to come forward when they feel like something is wrong. We remain concerned that workers who seek advice from their unions may fall outside existing protected disclosure arrangements. The NDIA has acknowledged that disclosures made solely to a union may not, in fact, qualify as protected disclosures under the current framework. So that creates a chilling effect for workers seeking advice before reporting serious concerns. If we are serious about exposing misconduct, workers must be able to seek advice, representation and support without fear of retaliation. So strong whistleblower protections are not a barrier to accountability. They are one of the most effective accountability mechanisms available. Chair, the HSU believes that the NDIS can both be sustainable and fair. We support reform, we support stronger safeguards, we support action against fraud, we support greater transparency and accountability. But sustainability cannot simply mean spending less. It means a true professional workforce, safe participants, independent oversights, effective safeguards and confidence that no person with a disability will be left without support because governments are still negotiating who should provide it. So after multiple reviews, inquiries, opportunities for reform, we say that this is the ample opportunity to recognise a workforce policy that is also an NDIS policy. Participant outcomes, service quality, safeguarding integrity, long-term financial sustainability, and are all ultimately delivered through workers. Any reform agenda that overlooks that reality risks repeating many mistakes that have challenged the scheme since its inception. So, in conclusion, we urge the committee to strengthen this legislation by embedding a national worker registration scheme, strengthening whistleblower protections, guaranteeing meaningful human oversight of adverse funding decisions, safeguarding SIL arrangements, and ensuring that no participant falls through the cracks before foundational supports are fully funded, staffed and operational. So these reforms will only succeed if they protect both the sustainability of the scheme and also the people who depend on it every day. Thank you, Chair.